Hi everyone, I'm Dr. Erika La Vella, co-founder of Art of Bariatrics, and there is a topic relating to sleeve gastrectomy and acid reflux that I just really want to share with you today, my take on acid reflux and how you can actually use acid reflux as a tool for further weight loss after weight loss surgery. So in front of me on our screen is a picture of a sleeve gastrectomy. And how I explain it to all my patients coming in for weight loss surgery is that we take a stapler at the bottom of the stomach and we narrow the stomach from bottom all the way to the top. And this light pink portion is what we end up removing. That is the excised portion of the stomach is permanently gone. And we tell our patients getting ready for surgery that it is really important that you minimize the amount of fluids you drink right before a meal, and even more importantly, that you don't drink anything for 30 minutes after eating. Now, this is a guideline. If you were to have slow stomach emptying, for example, or eat something like taco meat or ground beef. Ground beef has more fat in it, and that fat actually slows down the rate in which it empties and gets digested from your stomach. So depending on the type of meal that you're eating, the rate in which your stomach is going to empty is going to change. Now, to talk a little bit about the anatomy, you see here this picture points to an anatomical structure at the bottom of the stomach called the pylorus. The pylorus is hormonally active, and depending on how much protein or fat you've just eaten, that is the tighter closed the pylorus will be. So the pylorus is a muscle. It's a round concentric muscle, just like we have an anal sphincter. As an example, only we have no conscious control over it. It is really all dictated by the hormones and the vagus nerve, which is a very important anatomical nerve that when you're in our coaching program, I'll be talking about. But so this part of digestion is really important. And after a sleeve, because you still have this intact pylorus and because your stomach is so much more narrow than it ever was, it is incredibly easy to overfill such a small space against a tight pylorus and need that pressure to be relieved somehow. I also warn my patients this is why leaks that happen after a sleeve gastrectomy, which are pretty rare in my experience. But that is also part of this kind of pressure relief phenomenon. So let's imagine a perfectly healed staple line. We're not worried about leaks whatsoever. After surgery, somebody's eating, maybe in a group with other people. And as you're eating with other people, it's very easy to get distracted socially and just keep eating at the same pace as everyone else around you. This is also true of how life after surgery, especially the further away from surgery that you are, the longer the time it is that's gone by, the easier it is for you to, again, kind of forget about your tool. So when the stomach gets overfilled and it's back pressuring up, the first thing that opens up is the lower esophageal sphincter. The lower esophageal sphincter is going to open to get that sort of pressure relief. Likewise, weight regain. Weight regain is the first sort of major long-term coaching issue that Art of Bariatrics is tackling. Weight regain, even as little as 5, 10, 15 pounds, can be enough to recreate this pressure gradient in the stomach, overriding the pressure of that in the chest, also making it easier for that lower esophageal sphincter to stay open. So some tips for acid reflux after sleeve are chew your food very slowly, very mindfully, just like you did in those first weeks after surgery. The longer you can maintain that sense of patience and mindfulness with chewing and eating, the better apt you're going to be at really listening to the internal body signals of I'm full. Some people have gotten into the habit of eating until they feel excessively full. And so part of this kind of post-op exercise after a sleeve is all about retraining the brain and the body so that we can really listen to these internal signals. And eating more slowly is definitely a key behavior here to do that. Some tricks that we recommend are eating with a baby spoon or a baby fork. Maybe that's not something you want to do at your grown-up dinner party, but that's definitely something you can do at home. You can also eat on a smaller saucer or a smaller bowl. Again, that can kind of help visually cue you into the portion sizes that's needed so that you don't overeat. Likewise, on the same vein as overeating, it's incredibly important that you're also being mindful not to drink and eat at the same time. So just like if that pylorus is tight at the bottom, over you're eating and then putting fluid on top of it, you're just going to really increase, again, that pressure on the inside, overfill it and open up that lower esophageal sphincter. So that's why it's important to wait that 30 minutes at a minimum after eating, and sometimes even a little bit longer, or just continue to slowly sip. Slowly sipping your water. Sometimes people get they get thrown off by using straws, because you can swallow too much air. It's also important to not drink with carbonation, because sometimes that fizziness and the carbonation can also be kind of distressing, can also lead to heartburn or acid reflux after a sleeve. And of course, alcohol. So being really mindful with alcohol use to the point where you aren't always recreating, again, overeating, and also drinking too much. Alcohol also, just as a chemical property, it also causes relaxation of the lower esophageal sphincter. So I hope you enjoyed this explanation, and I hope you enjoyed these tips. And again, working with us with Art of Bariatrics, if you have heartburn, losing even just a little bit more weight, again, we can help you with that in our coaching program. And also using the sign of acid reflux as a tool that you need to eat a little more slowly, and that maybe you could afford to lose a couple more pounds, is quite dramatic in its ability to help reverse heartburn and acid reflux.